Okay, so thank you all very much. Thank you for coming back. Enjoy the rest of your cups of tea while we're talking. And I'm going to try and manage the dilemma of not talking too fast, but at least keeping to time at the same time. Okay, so I wonder how many of you have made journeys in cars with small children in the back and experienced that moment when there is a voice, "Are we nearly there?" And maybe we were guilty of that when we were children. So that's what it's felt like for us as we've been trying to get the Lesotho project off the ground. And I've already made a mistake here. Why is there?
Well, it comes up all at once. Slide.
Comes up all at once?
No, the other direction. That's it. That's your second slide.
Right, okay, well, I'll head over to Tony in just a moment, but just to say, that's what it's felt like for us. We've been trying to get this project off the ground, that it's been quite a long process. And it's often very tempting in conferences to produce a presentation which is upbeat, which is positive, and which says that everything is going well. But as I think has been mentioned by some others, there are always trials and tribulations, hitches and difficulties. And so we're going to tell it like it is, and Tabello is going to give us some background.
Honestly, Lesotho is a landlocked country within South Africa, and we are a kingdom. Unfortunately, we have got high rates of HIV. Now the non-communicable diseases are cropping up with cancer, complications associated with hypertension, diabetes, and others. And that has put our country in an enormous stretch in terms of the demand for palliative care. And unfortunately, it has not been recognized as something that is very much needed. So it had to start with a lot of advocacy, starting back in 2017. And that is how we felt, because I can no longer call it it is now a collaborative effort of our board of trustees. Yes, as a founder and as a CEO of the organization, born and raised in Lesotho, I certainly saw the care gap when I started working in UK. And I appreciated that the people back in Lesotho would also benefit for the level of care within the means and resources we had. And that is how Starlight Vision was born. And it took a lot of mindset change, a lot of perseverance. And I just took it as we see is PC. I said, what can I get out of the P within myself? And C out of myself. And I realized the P, I have to be passionate with what I'm talking about, persistent with it, and really persevere without giving hope, continue and really show them the benefit day in and out. With the C, it's about the consistent message that I've been passing on from 2017 till where we are. But it will not be fair not to mention the people that have played part in this vision, because it wouldn't be a story in our United Kingdom if not the hard work and selfless nature of Dr. Paul and Professor Fiona. Please, can you show up for the people to know you? Thank you very much. So following the journey of our meeting Dr. Paul and Professor Fiona and the other team, that was early 2020 at the start of COVID, I also enrolled in the course within our Cardiff University, where Professor Fiona is the head of the department. And she's got this thing in her nature, whereby when she meets somebody, she really takes care of the whole of you. It is the holistic approach that we preach in palliative care as compassionate workers, but to apply it between ourselves is very rare, but that is what she's good at. And one of them was, how is Lesotho? So I gave her an idea and she brought me in connection with the PCW family.
So a little bit about the Palliative Care Works perspective. So we met with Tabello and indeed with Paul and Carolyn, and we set up a small group, a working party. It consisted of George, one of the doctors, Ruth, one of the nurses, and me, well, the social worker in Palliative Care Works. And I'm still hunting for other social workers to keep that side of it alive as in the trustees. When you start out on the journey, obviously you need to know your destination, how you're going to get there, what the route might be. So there was a lot of work for us to do in terms of the early discussions that we were having. We had the working group. That's the whole of the trustee group actually, but we had the Lesotho working group. Lots of early discussions to sort all of that out. And it was pretty obvious, yes, that a training course in palliative care, basic course, was perhaps the way forward. Although we've been very well reminded, I think, today about not focusing just on hospitals, but actually thinking about the community, and that's something to challenge us. Lots of early discussions. And when we were thinking about a course, one of the big debates was about face-to-face or Zoom. And I just want to remind ourselves that in 2022, we had been cribbed, confined, as Shakespeare said, and contained almost physically by the pandemic and Zoom. And Zoom wasn't a word that was, I think, that well known to all of us in 2020. By 2022, we were all familiar with it. It was the go-to method for training, for teaching, for mentoring, and much else. And face-to-face was slightly forgotten, I think. But Tabello and Paul and we were really keen that it needed to be face-to-face. Palliative care is about relationships. You can do it by Zoom, but you can do it better. And initially, I think face-to-face. So we were delighted that they were going to go with that. And so we put together a plan for 2 one-week basic palliative care courses in Maseru, taught by a multi-professional group, doctor, nurse, social worker, and delivered to multi-professional teams. And that was the plan that we worked out to start with. But it was a provisional plan, and if you're going to get a plan to succeed, you absolutely need to get other people on board. And that is where Tabello comes in again.
The next slide, please. All the bullet points, if you can. So as we know, and we have learned, and we have been journeying through, it's all about advocacy, and advocacy is about time. It's about whether you have got knowledge, you have got the resilience to go on with the journey, and whether you have got the right connections. And truly, Visit to Lesotho has been more of doing those advocacy meetings with the government, meetings with the Ministry of Health. And we have also been privileged with Dr. Paul to present our case and challenges of people with life-limiting conditions at the Parliament. We have met the Prime Minister, and there in the picture I have got Her Majesty Queen, who is our patron. And we've been trying to use all the media platforms in Lesotho to try and really show the care gap, be on the radio station, let the public be aware, because they don't know any other option, they don't know any better, so they didn't even see the need. So that is why we were bringing the ministry to be aware that training the healthcare professionals in the multidisciplinary approach would best improve the patient care outcomes. Even though we didn't have money, but Zoom came into play with other partners collaboratively, PCW, APCA, Project ECHO, and other organizations like ICPCN, and that was something that we pushed on from August 2023 till October. That was a 16-week program, of which we had 120 cohort that registered in the second 8 weeks. The first 8 weeks was 100 people. So we did that every Tuesday, and we were about 20 professionals from across 12 countries. And that was just a work, just from the theme of our this year, thinking globally, but acting locally. And we were just doing everything from whichever room we were in our own houses, but people were benefiting, and they can tell us different stories of how that has impacted them. That's why we want to proceed now to the next level of face-to-face, so palliative care teams can be started, and the ministry is buying into it in a big way.
So I think quite a number of you might identify with the first picture on the slides. You start a journey, but it takes longer than you think. It certainly does where I come from in Herefordshire at the moment, because we're always meeting tractors full of potatoes and apples that slow down. And there were things that slowed us down and made life difficult on this journey. It was a great advantage to be able to do the Project ECHO course, and that's a model of its hub and the way it works out to really a wide range of people. And of course, you're not taking people out from their work. and it doesn't cost, so there are lots of advantages there. But there are also disadvantages with Zoom, aren't there? And so for us, one of the problems about it was that actually we had a screen where we're trying to manage 50 small screens at a time because so many people are on board. And then you don't know whether people are dropping in and out. The internet is dropping in and out. Sound isn't always good. And then there are those occasions when the screen is blank. And then you have to decide, are they A, having their dinner? So they've turned the screen off. Are they B, doing the ironing? Are they C, gone into another room altogether? Or D, are they bored stiff and catching up with their emails? So that working on Zoom is not always the most effective way. So there were lessons that we learned from electronic education, I have to say. And we faced a number of delays and difficulties, which in summary came down to the fact that the ministry was very enthusiastic, but actually was finding it really difficult to pen to paper and confirm that they would be able to support us. And obviously without that written guarantee, we couldn't go forward. So our original plan to be out in March 2023, moved to May 2023, to October 23, to spring of 2024. And finally we set a deadline and said we must know by August, the end of August 2024, if we're going to be teaching in November. We cannot keep blocking out our diaries. And so that was the deadline that we gave them. And we did begin to wonder whether actually we needed to find another route. We needed to be able to deliver something that didn't involve the ministry or didn't involve the ministry's say-so. And eventually it seemed possible that we could work with just 3 hospitals in a very concentrated way on Zoom and deliver an intense course. So that was our backup, our plan B. So yes, we were almost there. We had this revised plan and we were in the middle of working on it when we got an email from the ministry saying, yes, we would like you to deliver the course. And we would like you to deliver it face-to-face. We would like you to deliver it in the north and in the south. Yeah. And we would like you to do it in about 5 weeks' time. And we said, no. And when I say we, I have to say that was George and me and Ruth. I think it's true to say to Bello that you were rather taken aback at our response to the ministry. And you were really worried that the ministry would, let me find my words diplomatically, the ministry would feel they would put their energies elsewhere. But actually, that didn't happen. That didn't happen. And we do now have a course arriving. We have a course arriving in Maseru. And we've combined our thoughts. It's going to be a face-to-face course. Hallelujah. It's going to be bigger than the 10 people we were talking about when we were going to do it on Zoom. We're going to work with 5 hospitals, and each of them will provide a team or an embryonic team of a doctor, a nurse, and either a social worker or a pharmacist or a counsellor or a pastor, somebody like that. And possibly 1 or 2 from the ministry or from some of the training colleges. And we are thrilled to be going out there on October the 30th to meet the ministry and other players and then to deliver the course the following week. 5-day basic course. And if you don't know about the toolkit and the training manuals, then we have failed today, absolutely. Go back with them in your pockets, do please. We'll be using the basic toolkit course. So we're really thrilled about that. And I have to say that actually sometimes it's right to say no, I think, because the ministry have indicated that they would still like us to work to this plan of 2 one-week courses in 2 different places. And we're thinking about doing that in February next year. There's yet to be discussion about funding, so we'll see how that goes. But with a bit of luck, it would be next stop, February 2025. So yeah, almost there. And I'll leave the last word to Tabella.
For me, I think it's about appreciating the global interest in those that are remaining in the margins of our society with lack of access or no access at all to palliative care. And in this year whereby Lesotho is celebrating 200 years as a nation being founded by Kim Mosheshe on the principles of working together, servanthood, that family kind of orientation that we talk about in palliative care, that is being compassionate. I want to thank each one of you and other collaborations that we have as Starlight, who have connected us, brought us together, supported us, mentored us. Just one email and one SMS connecting us to the right people. Thank you, Mayor Caroline and Dr. Richard, because having been connected to you, you took our work serious. You could have not even sent a general email to your team to introduce our passion if you didn't take it serious. But that connection has really brought us to where we are, and we continue to get more support. And we hope and believe that through all the networks, we'll be able to make palliative care more accessible for the people of Lesotho, young and old. As we speak now, through all the support of others, advocating through the networks we already built globally as well as regionally in APCA and as well as in the country. We have been able to source some funding. We'll be able, as we go to Lesotho next week, also to prepare for the sorting that will happen on the 30th of October. As our colleagues come in to join us with the training, it is just an uphill momentum. And the officials, they can't wait. The government and the Her Majesty and the ministry, everybody is excited. And I can tell that time is really, really a currency of progress and development. So we should not give away and give up and give in when there's a delay, detour, frustration and opposition and disappointments, because I've seen it. The energy around you, as long as it is the compassionate, that one that has felt the passion within you, keep going. Keep going. Thank you.
Thank you very much indeed, Savannah and Julian. And I think it's entirely appropriate to end the conference about practical application of our training and education programs, taking it out to Lesotho. And we started the day by Rob talking about the challenge of integrating palliative care into universal health reforms. It's a practical opportunity for us to integrate palliative care with Tabella's help and her vision into Lesotho. So in a year's time, we would hope that we could report back the success of this program as it goes forward. We've done brilliantly with timing. I think I've never known a conference either because we haven't been stimulating enough to create the right sort of discussion, or you're so blown away by what you've heard that you need to go and have a lie down in a darkened room. So I'll leave you to choose whichever one of those alternatives you'd like. Michael is over there, sitting there, and he's a very modest man who hides his light under a bushel. But I would like to share with you the fact that he has recently retired from the board and stood down as a trustee. He's going to stay as an associate. But without your inspired leadership of the conference team, Michael, these conferences would not be what they have been for the time that you have been leading them. And I did say you had led these conferences for more time than you can remember, but you admitted the other day that you quite liked it, you quite enjoyed it. And I just wondered if you'd like to give us just a short reflection on your time as...
George, I think I need to quieten you down.
That might be a first, isn't it?
What I'd like to say very briefly is that one of the things, apart from everybody's shared experience, networking is clearly important, and it's not only nationally, it's internationally now, because colleagues are working all over the world, and as much we can share of experiences to help people develop, whether it's those in Brazil, those in Lesotho, those elsewhere. Just to finally say, I have enjoyed pretty good because it's provided me with meeting all these wonderful people every year and keeping in contact with Simon. Robert sitting at the back arrived this morning and said, "Oh, we met in 2017 and I'm back again." Then I learned he's doing a PhD in Sussex. And I said, "Well, you can liaise now with Freddie Collins and my son, who's the consultant there." But St. Christopher's, you know, we all know set off in 67. We set off here in 76. Palliative care works came around, and we're all in organisations that are interested in networking globally to spread, help people develop palliative care. The challenges that Robert made are huge, and how we grow advocates with the skill and ability to influence ministers will always be a huge challenge. But you know, Robert Twycross was the first consultant here. By the mid-80s, we were a WHL collaborating centre. We made links with South America, Argentina. We made links with Poland. We made links with India and other countries. And if he'd been able to join us today, he would have been delighted to see the breadth of contacts that we've been able to grow up over the years. So all I can do is wish you from Mary, myself, Charlie, who all have an association working here, wish you well in your endeavours, and keep in touch as much as you can with all your contacts from today. And thank you for coming.
Thank you to you, Michael. Finally, much thanks to the wonderful team here. Mary, thank you very much indeed. Michael, thank you for very much indeed for doing all that you've done. Unsung hero of many conferences. Yes. And you still got your hair and it's not grey. Well done. Thank you to all the speakers who have given us inspiring and very thought-provoking presentations. Thank you to those of you who are still online, zooming in. Thank you very much indeed for the comments that you've made. And thank you to you all. Safe journey home.